Ann James, a piano teacher who lives in a Richmond retirement community, remembers the COVID-19 lockdown.
We were advised to stay in our apartments as much as possible. We had special times to pick up our mail so that there wasn't too much opportunity to see people.
James says she felt safe because of strict COVID protocols in her community, but was concerned about the deaths at Canterbury Rehab and Healthcare Center.
It was terrible that one of the nursing homes not far from here had many, many deaths.
We saw COVID appear in New York City, then Washington, D.C., and we could see it move down I-95, Fredericksburg, and then that first case in Richmond. And we realized that, A, it was infectious, B, there was no cure.
Dr. Jim Wright is the former medical director of Canterbury Rehab and Healthcare Center, where he worked for 10 years.
We were thinking in our nursing home of about 140, 150 people. We would have somewhere around 25 cases. And out of those 25 cases, we could expect somewhere around 4 to 5 deaths.
But the center experienced one of the worst outbreaks of COVID-19 in the United States. At the end of the first outbreak in May 2020, Dr. Wright says 50 people had died.
At the beginning, you definitely had the sense that we were a little ignored slice of society that really didn't matter that much, and resources were not going to be diverted into the nursing home.
Canterbury staff feared they would get COVID, resulting in staffing shortages. Dr. Wright says it was chaos.
You had to work like you were in a combat zone. I have to get oxygen to this patient. I have to get IV fluids to this patient. I have to make sure they're hydrated, eating and drinking. I have to change them. I have to get them to an isolation room. You just had to focus on each individual task. You could not stop to think about the big picture, because it would crush you.
Dr. Wright says the Virginia Department of Health responded by providing testing for the center. Dr. Lori Forlano, the acting state epidemiologist at VDH, says at the start of the pandemic, the state lacked the tools to deal with the virus.
We've learned a lot about the COVID-19 virus, how it's transmitted, how it presents itself in a person, and how it can spread, and how we can, importantly, how we can control it.
Now the challenge is continuing to get shots into arms and making sure people's vaccines are up to date, especially for older Virginians.
There's plenty of places still to get free COVID-19 vaccine and get those bivalent doses in for extra protection, particularly for people who are older or more immunocompromised.
The vaccine was such a gift, and it gave us back our ability to be in the community and out and about.
Thank you for watching. Continue to follow Virginia news and stories by subscribing to our VPM YouTube channel.